This is my informative speech on anxiety and stress disorders. Stress and anxiety disorders are a group of mental disorders characterized by feelings of anxiety and fear. This is the emotion one is overcome with when one cannot possibly cope with the situation at hand. People tend to brush off these disorders for many reasons. They tend to do this because they do not feel as if stress and anxiety are that big of a deal, or maybe because they feel that these disorders are an excuse people make up when they're worried. While it is completely normal to feel stressed or anxious at certain points in one's life, if one is unable to live their life because of these fears and worries, then it can be extremely unhealthy. Stress, anxiety, and the many disorders that are attached are not something to be taken lightly, no matter how small the fear seems to be. There are 6 main types of anxiety disorders, each having their own unique causes and symptoms. These are generalized anxiety disorder, anxiety attacks, obsessive-compulsive disorder, phobia, social anxiety disorder, and post-traumatic stress disorder. Anxiety disorders are very serious illnesses and are not something people can just try to get over. People do not treat these disorders as illnesses like they should. Instead, they treat them like it's an excuse people make up for being the way they are. These disorders are real, with real causes and real symptoms. These symptoms include, but not limited to, pounding heart, sweating, headaches, upset stomach, dizziness, frequent urination or diarrhea, shortness of breath, muscle tension or twitches, shaking or trembling, and insomnia. There are different causes for different stress and anxiety disorders. A major cause can be worrying about upcoming events that are about to happen, that one is not looking forward to, such as a major test. Fear is also a major cause of anxiety disorders. According to the article, The Difference Between Stress and Anxiety, phobias of events, activities, or social situations are all rooted in terror, causing the person suffering from the disorder to panic when they come face to face with the stressor. Anxiety is like a snowball. It converts fear into feelings, and people who suffer from it tend to avoid what's making them fearful, which can make it worse. There are some specific stress and anxiety disorders with specific causes. This includes, but is not limited to, OCD, generalized anxiety disorder, and post-traumatic stress disorder. GAD, or generalized anxiety disorder, which affects 6.8 million adults or 3.1% of the U.S. population, is characterized by persistent and excessive worry about a number of different things. This disorder is extremely common and most people that suffer go through day-to-day activities seemingly normal. Symptoms of GAD include fatigue, restlessness, upset stomach, and insomnia. Panic disorders are characterized by repeated, unexpected panic attacks, as well as fear of experiencing another episode. Attacks happen at random, so naturally living with panic disorders, one becomes fearful of recurring attacks, especially during sleep. About 6 million American adults experience panic disorders in a given year. OCD is a common chronic and long-lasting disorder in which a person has uncontrollable recurring thoughts and behaviors that he or she feels the urge to repeat over and over. People with OCD do things in different manners than people without OCD do things. If one is suffering from OCD, they might practice a ritual before doing a daily activity, wash their hands more than a couple times for fear of germs, or maybe focus on a hanging picture that isn't perfectly parallel to the ground. Phobias and irrational fears is an unrealistic or exaggerated fear of a specific object, activity, or situation that in reality presents little to no danger. If you have ever read or watched a series of unfortunate events and have met Aunt Josephine, then you know what an irrational fear is. For example, this woman had fears of turning on the oven, real estate agents, and being too close to the refrigerator, just to name a few. One thing that should be known about irrational fears is avoidance of the fear can only make the fear worse. Social anxiety is a fear that is very common in today's society. Social anxiety is the fear of interaction with other people that brings on self-consciousness, feelings of being negatively judged and evaluated, and, as a result, leads to avoidance. If one has a fear of being publicly humiliated, doing things in front of a large crowd, or just have extreme shyness, they may have social anxiety. PTSD is a very severe anxiety disorder that happens when one has faced extreme traumatic events. This disorder is usually found through war heroes and soldiers coming home after serving their country. Symptoms of PTSD include flashbacks or nightmares about what happened, hypervigilance, startling easily, withdrawing from others, and avoiding situations that remind you of the event. Researchers are finding different reasons on how these types of disorders happen. Along with this, they are finding treatments to help patients overcome their disorders. In Section 9 of the article Anxiety Disorders, the article explains treatments for disorders and how patients and doctors decide on the proper treatment. Effective treatments for each of the anxiety disorders have been developed through research. In general, 2 types of treatments are available for an anxiety disorder medication and specific types of psychotherapy, sometimes called talk therapy. Both approaches can be effective for most disorders. For some people, psychotherapy might be a good choice because they might just need to talk about what's going on in their life. Other, more serious disorders might call for medications. This does not mean that medications are for the worse off, but everyone copes differently. Some disorders might need therapy and others might need medication. It's as simple as that. The choice of one or the other, or both, depends on the patient and the doctor's preference, and also on the particular anxiety disorder. For example, only psychotherapy has been found effective for specific phobias. When choosing a therapist, you should find out whether medications will be available if needed. This explains that a disorder might call for therapy and medications, rather than just one or the other. Disorders that call for both are not considered uncommon, mainly because doctors want to be sure that they are healing a patient. The treatment is still based off of the disorder, but has a lot to do with what the patient can handle and how that patient copes with his or her disorder. Psychotherapy and medications are the basic and main treatments in anxiety disorders. In a lot of cases, these treatments seem to help. However, in other cases, they can just make the situation worse. These treatments can have a negative effect on a number of things. One example is how the treatment impacts a person's family. Stress and anxiety disorders can already put a strain on one's family, simply because it is a mental illness. Take that into consideration, as well as the financial and emotional strain these treatments can cause. The cost can add up, and if a family is not prepared for it financially, it can cause a negative strain on a family, not to mention the stress that adds to the patient. The patient would probably end up blaming oneself because he or she believes it is his or her fault that he or she has an anxiety disorder. This can cause more emotional stress to the patient as well to the family. I know of someone that suffers from PTSD who has tried psychotherapy. She claims that therapy and medications only made her disorder worse. She says the only thing it does is bring back the bad memories that makes her realize that no one really understands what she is going through. She explained that her loved ones wants her to go back, but she is determined that she will never go to a therapist again. As someone who does not experience PTSD firsthand, it is hard to see which is the best solution for her. To go to a therapist where she will talk to someone with a degree that knows what he or she is doing, or to let her do what she wants and see if she can try to figure it out on her own. This is why these types of mental disorders are so tricky. I can see what is wrong with her, and I can assume that psychotherapy and medication is a good solution if she would just try it for a little bit longer. But if she has already tried it and does not think it is good, then what do I know? Bringing awareness to people about stress and anxiety disorders are extremely important. Stress and anxiety affects many people, yet a lot of people do not realize how dramatic these disorders are. According to the National Institute of Mental Health, 40 million American adults are diagnosed with an anxiety disorder. Most people deal with anxiety on some level from time to time, but anxiety disorders are characterized by prolonged periods, at least 6 months, of exaggerated worry and fearfulness that keep people from doing things most others take for granted. This shows that a study just filled with American adults gave a result of 40 million people dealing with some type of anxiety problem. This study does not even include children who are living in America, and there are plenty of children dealing with stress and anxiety. There are ways that have helped raise awareness throughout the world about different types of stress and anxiety disorders. there are organizations that are exceptionally helpful for people with stress and anxiety disorders, such as the Anxiety and Depression Association of America, or the ADAA. Their organization helps those in need by listing all the possible disorders, finding therapists and treatments to help, finding ways to take action by donating or spreading the word, and many other things. Their website at www.adaa.org is perfect for the people that have these disorders and do not know what to do next. The Ross Center, founded by former CEO and president of ADAA, Geraldine Ross, is a great treatment center for these disorders. It explains specific types of disorders, and there are many different treatments for specific cases. The Ross Center has some of the best psychiatrists and psychologists, social workers, and psychiatric nurses in the world. Another way to raise awareness for stress and anxiety disorders are national days or months. For instance, National PTSD Month is during this month, June. During this month, the National Center for PTSD and many others gather together to help raise awareness for PTSD. The purpose of PTSD Awareness Month, is to encourage everyone to raise public awareness of PTSD and its effective treatments. We can all help those affected by PTSD. Greater understanding and awareness of PTSD will help veterans and others recognize symptoms and seek and obtain needed care. This is a very important way to raise awareness for a specific type of stress disorder. Even though the focus is mainly veterans who suffer from PTSD, National PTSD Month raises awareness for everyone who suffers this disorder. Stress and anxiety disorders are real illnesses with serious causes and symptoms, just like any other illness. People downplay these disorders mainly because stress and anxiety can be shown in different ways. They believe that a stress disorder or anxiety disorder is just an exaggerated way of saying the individual who suffer from these conditions are overwhelmed, but this is not the case. Mental disorders such as these pose a real problem and can occur in anyone. There are ways to get help and cures to these disorders. There are treatments suitable for the different types of disorders and many ways to spread awareness. As soon as people stop treating it as an excuse and start treating it as it is, the world may be a little bit healthier. Thank you.